My name is Lydia Washira. I am a trained psychological counselor working with Kamili as a program manager right now. Kamili Organisation is an NGO. We provide free mental health services in Nairobi. We run 3 clinics here. We run Lower Kabete Clinic. We also run Kagemi Health Center, and we also facilitate Kihara Sub-County Hospital mental health outreach. We believe in bringing peace to 1,000 minds because mental health issues disrupt a person's peace of mind. It's very scary, very unpeaceful to feel like you're hearing voices, to feel like you can't be able to wake up in the morning, to keep on fighting suicidal thoughts. And so by being accessible and affordable in Kamili Organisation, we provide peace through counseling, providing meds, and reassuring them. We also work with families so that they can understand where and how their family members or relatives are struggling, so that they can be the right support system for that patient. I would start back to how Kamili started with our founder, Melanie.
My name is Melanie Blake. I am the founder and program director at Kamili Organisation. I grew up in Kenya and I have a great love for this country and its people. And when my husband brought me back to Kenya 17 years ago, I was already a mental health nurse and I knew that I wanted to use my skills in Kenya. So with our original clinic at Lower Kabete, I could see that 5,000 patients were benefiting and not having to be admitted to hospital. But I realized that this needed to happen all over Kenya, which is when we came up with the nurse scholarship, so that we provided mental health nurses in all the counties of Kenya.
I'm Flora Ruitururi. I'm a psychiatric nurse. I was trained by Kamili. I completed my training in Mathare in 2019. Then I went back to my place of work, that is Engineer County Hospital, and started operating a psychiatric clinic, which we conduct every Wednesday. So with the help of my medical superintendent, I wrote a proposal and I was given the permission to start outreaches in health centers where I had a great number of the patients with mental illnesses. So I started at Jabini Health Center, Magumu Health Center, and Murungaro Health Centers. Those are the health centers in Nyandarua, Kinangop Sub-County, where I'm operating a monthly psychiatric clinic. And patients are responding well, they are getting help. Kamili Day is a day that we come together, psychiatric nurses who have been sponsored by Kamili Organisation. We share our experiences on delivery of mental health services, since we were working in different counties, different environments, which help us on how to implement the mental health services plan very well. We also get updates on mental health issues and treatment.
And so the increase in patients are limiting our funds, okay? We are still a very small team, whereas we could, benefit from a larger team. We could benefit from more counselors, more social workers, being able to afford more, human resource, so that we can cater for bigger numbers of patients.
In a smaller way, anybody could support somebody at Kamili. It costs $1,500 to train a nurse and settle them back in their county hospital. Or a patient, all of them need support, and it costs $30 a year to support a patient with their medication that they probably wouldn't be able to afford. We also have lots of people come and volunteer their skills, whether they be a counsellor or an event manager, or like you are today, coming to film us. So there's so many ways in which people can help. Thank you.